Exactly. Nako, ang topic natin ngayon andito pa rin tayo sa ating civil litigation cases, yung mga court proceedings, yung mga when you're suing an institution or organization, and a sub area is what we call clinical negligence. You may have heard of it. Karamihan sa ating komunidad ay from the medical community. So, alam na alam itong topic na to. And as we said earlier, wala po kaming, it doesn't mean it doesn't mean I respect the medical community any less. It's just a part of life. Human error is a part of life. And that's the reason us lawyers, this is an area of law na quite, we would say very interesting for me because of the risk in terms of those professions and how the system manages those risks via insurance. And when both lawyers are arguing about whether successful ang isang clinical negligence, mahirap talaga. So, hindi naman yan ganun kadali na dahil na may injury or may outcome na hindi positive, may negative outcome, automatiko na yan na successful ang clinical negligence. You will see that it's actually quite hard to prove it. Quite hard, it means kailangan mo ng, ng evidence in proving, well, four main elements. We will call it four main elements, although minsan sinasabi na lang nila tatlo kasi almost given na yung number one element. So when you're trying to prove a clinical negligence case, these are the elements of the case. And in that order, kita mo link to each other, that you need to evidence, to support sometimes by expert opinion, and to support also and to corroborated by other evidence too. So hindi lang dahil damages, hindi lang yan damages, kung damages lang yan o dahil nagkaroon ka ng injury, tapos na yan. But these are apat. First of all, you need to prove duty of care. What does that mean, duty of care? Very simple. Ang isang organisasyon or tao, professional, owes a duty to take care of this person, of the claimant, and not to injure him or her. Very straightforward sa medical situation. Doctor, nurses, laboratory workers, ambulance workers, and so on and so forth. So that's the reason sometimes sasabihin nila, hindi, tatlo na lang talaga kasi given na yung duty of care. But I have to just add it there para ma-spell out, especially for law students who might be watching. So you will hear about these elements of the case in your study of kahit negligence lang, normal negligence, professional negligence, but in this particular topic, we're talking about clinical negligence. So duty of care, very much given. Kung nurse, ang doktor, ang laboratory, registrar, sister, they all owe you. Sister is a term here in the UK for a nurse. Tama ba ako yung mga talaga NHS? It's a term here for nurses. Lahat sila owes a duty not to hurt or harm a patient. So, given na yan. Madali lang yan. Breach of duty. So, you have to prove na hindi nila na-follow yon, that they have caused harm, that they have failed in their duty. How do we know that? We look at the policies, we look at the procedures, we look at the guidelines. So, that's the reason why a lot of our medical professionals, they're heavily trained in following NICE guidelines. They're very much trained in following protocol. Meron silang may mga literature or guidance na binibigay ang mga ospital on how to deal with certain situations. So that pare-pareho ang standard of care, duty of care, ang standard of care ng mga professionals na yan. Sometimes they would breach that duty by, well, ang classic example ng mga clinical negligence natin is delayed diagnosis, misdiagnosis, delay in treatment, wrong treatment. So, sometimes they would say that sa isang guidelines, they would say you must treat the patient within this hour, 8 to 10 hours. The first dose of the treatment must be given that within that period. Kung ganon ang symptoms presentation of symptoms is like that, then this must be followed. So kung hindi na follow yon, call it delay of treatment, that's a breach of duty. In one example, someone might say that in closing up yung favorite ni Mr. Laraga na example, naiwan yung gunting. Siguro meron tayong, I would imagine, meron silang closing up the patient procedure. May mga final checks sila sa surgical team would go through their final checks. There would be a guidance on what to do. And, you would look at it and you would say, well, na-follow ba yung standard of care na yan, because clearly may naiwan na gunting doon. So that's a breach of duty. Babalikan natin kung ano yung mga mandate, kung ano yung nakalagay na standard na pina-follow with a hospital. So that's, or with a particular treatment method acceptable sa kanilang field of practice. And we can have may mga certain situations na sample cases is there was an alleged mistreatment ng isang knee surgery. The allegation was the doctor failed to use the right size for that particular knee. So could be a breach of duty kasi titingnan ang tanong sa eksperto, hindi po sa abogado, ano ba ang gagawin ng isang reasonably competent na doktor sa ganyang sitwasyon? And we call that test, ito sa breach of duty, meron kaming test na tawag dyan when you ask the breach of duty, the Bolam test. B-O-L-A-M test. If you're a law student, that would be interesting. If you are just part ng ating RSP, that's just another dagdag kaalaman jargon buster. Bolam test is from the case of Bolam. I think it is actually Bolam versus NHS. That's the test on whether ang isang professional ay naka-breach ng duty niya. So what we do to ascertain that is to ask a reasonable body of doctors of the same field whether they would have done the same thing. So tatanungin kung yan ba ang standard sa inyong field, yan ba ang gagawin ng isang reasonably competent doctor. So as lawyers, how do we prove that? We normally get an expert. So kung dun sa example ni Mr. Laragan, that would be a surgical maybe a surgeon na alam, eksperto sa procedures at treatment, reasonably competent application of skills in surgery, in general surgery. In my particular case, the knee case, it would be an orthopedic consultant maybe who will say, well, ano bang gagawin ng isang reasonably competent orthopedic consultant kung ganon ang presentation ng pasyente sa ganyang sitwasyon? Would they have picked that size of a knee replacement? So yun ang mga tanong namin sa expert. The expert would have to prove that na mali talaga yung ginawa, mali yung desisyon na taken, mali yung stepwise process na sinundan ng professional na to. Now, if you've proven that, check muna dyan, check. Hindi pa rin, kulang pa rin. Hindi kayo pwedeng, na-prove ko, hindi niya ginawa yun. At nagkaroon ako ng, for example, na-prove na naiwan yung gunting sa surgery. And then sinabi na ang damages ko actually is I have trauma. I have psychiatric damages, na depress ako and all of that. Now, hindi successful pa rin yung case dahil hindi pa natin napuprove yung causation. This is what we call a but-for test. But for this particular situation, nangyari ba to? Ibig sabihin, ito lang ba? Kita niyo yung link na yan. Ito lang ba? Itong breach of duty lang ba? Dahil that's the reason why meron tayong approach. Itong breach of duty lang ba ang rason bakit nagkaroon ng ganitong injury? And what is the injury? So, in a particular case, say for example, yung gunting na example ni Mr. Laragan, yes, may breach of duty, pero yun ba ang dahilan bakit siya depressed? Or depressed na siya before that. So we have to ask those questions. We have to prove na yun lang ang dahilan, or materially that was the cost of that injury or death or damages or losses. So with the other example, meron tayong knee surgeon, mali yung nalagay na size na knee replacement, nagkaroon ng knee damage. We have to prove na yung knee damage was caused by that wrongly sized knee replacement at hindi dahil may genetic na deterioration na yung knee. So that's the sample of that. Kailangan mo talagang i-make sure na it's very clear na yun lang ang dahilan. And that's actually very hard to prove because, again, lawyers can't give our opinion because it would have to be a medical expert, medical legal expert, who will give an opinion, an expert opinion about this. So, meron na namang eksperto. What if may breach of duty pero walang loss? Walang epekto sa'yo. Hindi, it was harmless. Walang nangyari, hindi ka nasaktan, hindi ka nagkaroon ng injury. What if that was it? Pinainom ka, halimbawa pinainom ka ng dapat paiinumin ka ng isang gamot, pero pinainom ka ng ibang gamot, however, wala namang damage sa'yo. Walang injury, you probably didn't know about it as well. Nakita mo lang when you were looking at your medical records. May case ka ba? Unfortunately, kung walang damages, walang losses, English law says, wala kang case. There's nothing to compensate. So, kailangan kompleto pa rin yung number 4 element. Kailangan you have to prove may damages, and that could be financial damages as well, loss of earnings, loss of income because meron kang injury. If a family member died because of clinical negligence, yung next of kin or yung executor ng estate can still sue, and they can prove as well financial losses kung breadwinner ba yung namatay and they were all financially dependent on the person who died. The same thing if you need to have certain changes sa say for example yung clinical negligence, na-prove mo yung duty of care, breach of duty, na-prove mo yun lang talaga yung dahilan na bakit may ganong injury, and ngayon paraplegic na o paralyzed na yung tao, then you have to make all necessary changes sa buhay niya. For example, you have to have a bungalow instead of a flat dahil for access, that's also losses. The same for care, the same for loss of earnings for the rest of his or her life. So those are losses. But you have to evidence that. If it's an earning loss, the same as yung mga pinag-usapan natin with road traffic accidents before, that you have to evidence that with historical losses. So if you were a nurse and nag-suffer ka din ng medical negligence, you can say, well, I would have been in the highest band kung hindi nangyari to. Kung hindi nangyari tong clinical negligence, and now I can't work anymore. So that's a way of proving it. As you can see, it's not straightforward. Kaya hindi lahat ng cases would automatically, sometimes you think it's a strong case, but then maybe experts don't agree. Dito pa lang, breach of duty pa lang, or sa causation, they don't agree, or may differing opinions. That happened as well in one of my cases na sabi ng isang expert, hindi, tama yung kabila. Sabi naman ng isang expert, hindi, tama sila dito, yung kabilang partido naman yung tama. That can also happen. It does happen. I know, dapat isa lang yung, sometimes I also believe, kasi hindi naman ako medical expert, hindi ko medical professional. Sometimes I thought isa lang yung answer, sasagot, but may iba na may scope for interpretation, may scope for judgment call, yung mga bagay-bagay. And doon nagkakaroon ng gray area, kumbaga. That's, from my own experience of getting experts report in these cases. So it's not as easy as people thought it is. It's actually very well argued, mostly very well involves quite comprehensive arguments between lawyers. A lot of documents as well, dahil kukunin ang mga hospital records, titingnan kung ano nangyari. Kukunin ang mga GP records, titingnan kung may mga genetic diseases ba that would have impacted on the causation. Titingnan kung ano yung situation mo before the clinical negligence. What were you earning? Ano yung buhay mo? What were your day-to-day life was? And then ano yung impact ng injury sa lahat na yun, sa day-to-day life. As I've said, some people will say, well, hindi na ako nag-gym, hindi na ako nagsicycling, I don't travel anymore. Some people bedbound na. So those are things that we need to look at, and we need to look at sometimes with the assistance of an accountant, kung ano yung impact sa magkano ba yung earnings that you've lost throughout your lifetime. And I had a case like that. A loss of an eye. It was settled in the end, but we had to look at, because he can't do the same job anymore, and we had to look at if the accident or if the negligence did not happen, my client would have earned this, but now he can't earn that, so we're claiming that from the other side. When I say the other side, sipin nyo, yan ba yung doctor, yan ba yung nurse, yan ba yung laboratory worker, sila ba yung kukunan nyo ng compensation? Attorney, no, it's hindi po yan. As we said earlier, may insurance. If you're here in the United Kingdom, you've heard it, lahat tayo insured. May home contents insurance tayo, meron tayong car insurance. The same with professionals. Lawyers have insurance. Professional indemnity insurance. Doctors do have insurance. The NHS have their own sort of insurance fund. And lahat yan naka-earmark really to manage the risk of human error. And that's the reason why I'm explaining that the fact that clinical negligence is a sub-area is a specialty, is being pursued, it doesn't mean a disrespect to the sacrifices of our healthcare workers, but actually it is a truth of life that we have to deal with, and that the system is there. As you can see, the legal principles are there to make sure na talagang salang-sala, naka-filter kung ano lang yung matataas ang standard ng kailangan mong i-prove. It's quite robust. Marami mga apat na elemento that you really have to pin down before you can make a successful clinical negligence claim. One thing to remember is that you only have 3 years, maliit lang pong period, to either sue private hospital man yan, or NHS man yan, or settle within 3 years. After that, you'll be statute barred. Of course, parties can agree extension, but what you need to really remember is don't rely on that. Don't rely on an extension na mag-agree 3 years. So sa dami ng kailangan i-prove, sa dami ng informasyon na kailangan i-gather, it's not a long period of time. So if you are thinking of potentially uh, making a claim for clinical negligence, make sure na andyan yung mga impormasyon nyo, gathered yung mga hospital records nyo straight away, and please seek independent legal advice as soon as possible. Dahil time is only short for lawyers. The more time that they have to investigate, the more time that they have to gather evidence in your case, the better. So, not necessarily us, but we do. I have worked. This is one of the areas I've been quite passionate about. Even before pa nung pandemia, when I was a young lawyer, it's one of the things. One of my early big cases was on this area of law, and this is something that you're hoping to get one person into a better position in their lives because of something na hindi naman aksidente. Minsan aksidente lang talaga eh. Wala namang ginusto. Walang, no one wakes up in the morning saying, oh, deliberately gusto ko magkaroon ng, gusto ko makasakit ngayon. But because if that is the case, then that is a criminal matter. That could be a criminal manslaughter kung may malice na involved. But these cases, mostly when we're dealing with on the civil side, it's may aksidente na nangyari. So it's good from a lawyer's, if you're a law student, from a lawyer's point of view, hindi lang to ambulance chaser or hindi lang to dahil it's a criticism of the system. You're hoping to get a person na probably with less resources dahil hindi na sila nakakatrabaho as they used to a better position in their lives. So from my perspective, that's something that could be very fulfilling. But yes, as I've said, to recap, 4 ang elemento. Madami, 3 years, tandaan, 3 years lang to really make sure that you can prove all of these elements. At nakita po natin ang flowchart na yan. Link po yan lahat. Hindi yan separate elements. Link yan lahat. Duty of care, breach of duty, remember Bow-Lamb test, causation, dapat yan ang link, yan lang ang attributable yung injury dun sa breach of duty of care na yan. And hindi lang ang abogado ang kailangan mo sa kaso na to. You do need experts that can prove on those particular areas of medical field, kung ano man yung area na yan, whether it's surgery, ophthalmology, orthopedic, that they're able to prove those elements in a medical, legal manner. Yes.